Welcome back to Africa Science Focus, the weekly science and development show from SciDevNet. I am Ogechi Kianyo. This week, we're delving into how prepared African countries are for future health emergencies. Africa has faced its share of disease outbreaks, such as the 2014 Ebola virus outbreak and the more recent COVID-19 pandemic. The COVID-19 pandemic, although global, had severe consequences in Sub-Saharan Africa due to poor responses in many countries. These outbreaks resulted in numerous deaths. The World Health Organization recorded 11,325 deaths from Ebola and 256,900 deaths from COVID-19 in the region. In addition to the health impact on citizens, the outbreak slowed down the economy of countries due to border closures, decreased trade, flight cancellations, and other social distancing policies. According to the United Nations Development Group, West Africa may have lost an average of at least $3.6 billion every year during the Ebola outbreak. And as stated by the World Bank, the COVID-19 pandemic was estimated to have pushed close to 40 million Africans into extreme poverty. The COVID-19 pandemic provided valuable lessons that can be used to prepare for such emergencies. To ensure these lessons aren't missed, South Africa's National Research Foundation and the Scientific Granting Council's initiative in Sub-Saharan Africa created the COVID-19 Africa Rapid Grant Fund in May 2023 to assist research and science around COVID-19. In this episode, COVID-19 African Rapid Grant Fund recipients share their research on responses that Africa can employ in the event of a future pandemic or health crisis. Now, let's join Michael and Jean Ngamba, a public health specialist and founder of Health Edu Limited, an e-learning platform for health professionals.
Jean is speaking to me from Pretoria in South Africa, but he is usually based in Rwanda. Jean, what major challenges did Africa face in dealing with the COVID-19 pandemic? Why, according to your perspective or research, wasn't the continent ready to deal with the pandemic?
The reason why I think that Africa wasn't a continent ready to deal with the pandemic, and actually the major challenges that we faced in Africa, this includes, but not limited to, lack of processes in some organizations and some countries, lack of preparedness measures, lack of infrastructure in some parts. We also have issues of less budget for health services, lack of procedures for continuous professional development for healthcare providers. These are some of the issues that really were raised in that kind of time.
COVID-19 imposed severe restrictions on people's lives, and the consequences, like death and displacement, continue to be felt. Understanding these impacts is essential for preparing for future emergencies and determining the necessary actions. To learn more, we turn to Michael as he speaks with Professor Lorena Núñez Carrasco, who conducted research into the pandemic and its negative impacts in South Africa.
Professor Carrasco is an interdisciplinary scholar and associate professor in the Department of Sociology at the University of Witwatersrand in Johannesburg, South Africa. Professor Carrasco, you had a keen interest in researching dying and death in relation to migration and displacement in South Africa in the context of the COVID-19 pandemic. What did you uncover through your research, and what can be learned through it to assist the continent to prepare to deal with future emergencies?
Together with a team, we conducted interviews and surveys, and so a number of methodologies as part of our research to try to assess the response of South Africa and the impact on vulnerable communities, the response on COVID-19 and the impact on these communities. And I researched on death and dying. And this is part of, if you could think of the most critical phase of an epidemic, when people die. And obviously, many regulations were put in place in order to protect communities but prevent contagiousness that were presumed to be in the bodies of human remains and so on. Now, these initiatives make a lot of sense from a public health perspective, but not so much from the communities involved. And it was very painful, specifically in the beginning of the epidemic, to see how these restrictions were so imposing a distance among communities that lost family members. They were so troubled by the difficulties that they had to mourn and to bury the beloved ones in a dignified way. So these aspects I was focusing on and looking at how this could have been mitigated and what are the long-term effects of these interventions, and how communities in a way could not come to closure with the loss of their beloved ones and lost communication. And when families had to take somebody to hospital, they never knew what was happening until the very end, when the body wasn't even given to them, but to funeral parlors, undertakers that took charge of it, and medicalized death in a way that was very painful for communities. So that's something I wanted to highlight. And in addition to that, because I work with migrants communities, migrants that usually repatriate the bodies of the deceased in order for them to be buried back home, they had further complications because the borders were closed, and the possibilities of really accompanying a body to repatriate them, as usually they do, a whole group of people coming to bring the body back home, that was really not possible. And so therefore that many of the deceased had to be buried in a place that is not home. And that will mean that in the future, most likely, they will have to exhumate and repatriate if that's possible, and it involves finances and so on.
How important is research in preparing for future emergencies?
Well, this is actually central. This was unexpected, impacted the whole world. And we didn't know how would this work and how communities needed to respond, how government needed to respond. Now we have accumulated research in all diverse areas of society and response and medical aspects and communities and so on. All of this information needs to inform policies to respond to emergency, future and current also, because what happened now can inform a better response in all regards.
With the constant threat of health emergencies, various reforms must be implemented to ensure that countries are prepared. Research is an important part of getting ready because it helps governments predict and mitigate the effects of pandemics and emergencies. We learn more from Jean.
What would you recommend needs to be done so that proper measures are in place to deal with health emergencies that may arise in the future?
First of all, I think we need to really work a lot on at the policy level, availing policies that allow people working together, having policies that can really force people to collaborate, and that this would really help countries to get ready much more. And having researchers and journalists all together, being in collaboration so that the people, the layman person can get the information in a simple language, because normally we have evidence that are written in all scientific terms that layman may not understand. But if there is work between journalists and researchers, there is a possibility to avail information to the layman so that they may know what to do in a simple term and simple steps. And then again, something that needs to be done would be like cross-border activities, like having healthcare professionals in different countries working together. Same with security, same with journalists, so that we may learn from each other and know how to respond in case of any emergency.
Jean, what about from the government perspective of African countries? What do you think they could do? You briefly mentioned about policy there. What measures can be done so that in case of a future emergency, countries on the continent would be able to deal with these emergencies adequately?
I think there is a need for different countries to increase budgets that goes to healthcare, and also to avail like an emergent fund, because some of the countries were relying on external funding. As well, strengthen the capacity development, like increasing the capacity development of healthcare professionals, and as well, not forgetting the community health workers. These community health workers are vital. They are the ones actually who are next to door in the villages, helping people. So I think that would be something that can be added in addition to having this kind of interministerial work, whereby the Minister of ICT would collaborate with the Minister of Health to avail these kind of solutions.
What measures are you aware of that have now been put in place across the continent in preparation for health emergencies that may arise in the future? Are there any examples from your country or other countries that you can point out?
What I know from our country is that our country has gone, that's Rwanda, has gone far in terms of using digital technologies to be able to detect immediately what's happening, like the use of drones in disseminating information that was used during COVID-19 was something new, whereby a drone could be able to go around where people are gathering and then tell them you get separated. We are not able to do this, whereby we have been able to have robots at the airport that can detect body temperature. So we've been working on as well having posts at borders that can be activated immediately whenever there is something. So these are the measures that are in Rwanda.
Is there any inter-country cooperation you are aware of that is in place to deal with such emergencies? And is it essential for countries to cooperate together in dealing with emergencies?
Yeah, I can say that within the East African community where I'm from, there was collaboration between countries like Rwanda and Uganda, Kenya. These were there during the COVID pandemic, and I think actually to be able to deal with such emergencies, there is a huge need. It's really essential for countries to cooperate together to deal with these emergencies. You know, science, let's say microbes, they don't know any border. So for microbes to go from Rwanda to Burundi or to Burundi to Tanzania, it's very easy. So there is a need for policymakers to strengthen this kind of inter-country cooperation to be able to deal with emergencies. The example of the East Africa, whereby there was discussions between Uganda and Rwanda, that would be an example. That was during COVID-19 to be able to deal, because there is one post border between Rwanda and Uganda, where they were dealing on how they're going to be handling the situation during the pandemic.
Jean emphasizes the importance of collaboration among African countries to tackle the impact of health pandemics. Communities are more vulnerable to health emergencies and often bear the brunt of stigmatization and negative consequences. To find out more about how vulnerable communities are affected, we go back to Michael and Lorena.
Now, you are also keen on exploring identity of communities. Do health emergencies change the identity of a community? And what examples might you be able to give on the continent? And also as well, Professor, how can we better protect the identity of communities on the continent when emergencies occur?
Okay, unfortunately, when people get sick and when we encounter these sort of unknown conditions, unknown to people, new type of infections, new epidemics, there is a lot of fear, and that sometimes is expressed in the form of stigma. People are labeled and stigmatized because people don't know, communities don't know exactly what are the consequences of these conditions. And this alienates communities. So in a way, the issue of identity, it is spoiled by illness, by disease, by epidemics. Spoiled in that there are associations, attributions, fear around that, because there is no knowledge, right? And this actually can alienate individuals and communities. They can feel marginalized. They will maybe avoid disclosing what they have. They will not adhere to the required protocol because they will fear being stigmatized. So we have to be very careful that whatever condition is out there, and South Africans and Africans know it well, especially in relation to the HIV/AIDS epidemic and how much stigma was built around that, and how that it made it so difficult to treat, to disclose conditions, to test, to adhere to treatment. So we have to be very mindful of the importance of transmitting information that is in a way dispel stigma and fear. Therefore, communities and identities of communities around conditions of such as the one that we just experienced is something that we always have to be mindful and work with them, work with communities in order to dispel fear and give confidence and give a positive image. And with HIV/AIDS, the continent as a whole has a lot of experience and what has worked and what could be replicated and amplified so that so that is part of the response.
Apart from being an associate professor in the Department of Sociology at the University of Witwatersrand in South Africa, you are also an interdisciplinary scholar. How important is cooperation between academic disciplines on the continent in preparing for future emergencies?
It's absolutely essential, because this is not just biomedicine. It is not just what happened to your body and how the viruses spread. It's all around behavior, because it's human behavior what can lead to prevention or infection. And when we talk about human behavior, we're talking about humans in social context. So from the start of the definition of a condition such as COVID-19, we can understand that there is the interdisciplinarity embedded in the phenomena that explain how it emerges, how it travels, how it affects vulnerable communities, how can be prevented, and so all of that is social, and therefore is social behavior. So I'm thinking of health promotion, I'm thinking of sociologists, anthropologists, economists, and that's my practice. That because I work on health issues, I have an understanding of the need of interdisciplinarity to respond adequately to emergencies.
You have also researched how economics and politics influence society. How significant is politics and the economics in Africa in determining how countries prepare for emergencies? Looking at the wider context as well, what is the role of governments in dealing with emergencies and preparing for them?
Yeah, and that's unfortunately another good aspect that our governments did not consider with sufficient care. Somehow the whole response around COVID, and this is not something that I'm saying, many are saying, was geared for, it did not suit the majority of people in this continent. people who work in informal activities, people who could not isolate and could not be under lockdown and take even purchase the protection devices. So all of that was built under presumptions that everyone was middle class. They could lock down themselves, work remotely, have computers, homeschooling, which did not wasn't able for thousands and if not millions of people. They were not able to do this. And so I think that the response needs to be much more tuned with what are the economic needs of our groups and how the government can more sensitive response to what they're asking communities, right? Everything came late. There was an extreme impositions of regulations which did not attend to the needs of people. And on the other hand, the political situation is also, it has influence as well, because places where the government did not have much credibility meant that people did not adhere or believe on the information they receive around the virus. And so a good response goes hand in hand with good governance, right? With governments that are responsible, that have a sensitive response for their people, who they really show care, and that the response is sensitive within the majority of people, which wasn't really the case in many of our countries.
We discussed the role of technology in assisting health professionals during health emergencies in the future. Jean provides insights through his e-learning platform for health professionals.
Now, Jean, you are the founder and CEO of Health.Do Limited, which is an e-learning platform for health professionals. What role can platforms like yours play in preparing countries on how to intervene in health emergencies? Do you have a framework system in place on your platform to prepare health professionals to deal with such occurrences?
Thank you very much. We actually availed a website application which is a user-friendly platform that is equipped with health contents. And we have a process that we renew all the contents that to fit with time. And then we have contents that are cutting cross from disasters, emergencies. We have contents related to ethics and medical malpractice. And we organize webinars regularly for healthcare providers to have tips on what to be done in case of emergencies. And lastly, we have been able to organize a training for digital literacy for healthcare providers. This is like empowering them to the level that whenever there is anything, they will be able to jump online so that they may have a discussion. Yeah, for us, what we have is the platform has different courses ranging from non-communicable and communicable. We have those kind of courses ranging from allowing the medical doctor or any other healthcare provider to know the setting of the environment, how they can manage in terms of environmental factors, and as well as how they can liaise together with their co-workers in the same institution, but also allowing this kind of communication and collaboration. So we think that by equipping healthcare professionals to that level, this is a way forward, that the platform is like actually changing those contents to fit with the particular person who is coming to us. So that's how we do that.
Have these courses that you have put out there for health workers been implemented practically by them in any way, shape, or form?
Yeah, we have currently about 7,000 healthcare professionals on our platform with a network of 65 health experts who develop our contents. So we are being facilitated by a different organization like JICA of Japan, like Enable, the the Belgium Development Agency. We're working with YAMK, which is the University of Applied Sciences in Finland. So we are developing contents that are coming to all these professionals, and we see always the completion rate of them. So we can see that they are really consuming the contents, and if we increase more on contents or for the preparedness and readiness of organizations and institutions in health for emergencies, this is really the future.
Do you feel that the private sector has a significant role to play in preparedness for dealing with emergencies, or do you feel that the public sector or the governments play more of a crucial role?
This question actually reflects more on what of the work we've been able to do currently during COVID-19 with the East Africa Healthcare Federation. So I'm part of the Rwanda Healthcare Federation. We've been able to pool activities related to developing a tool that may be used for preparedness in case of emergency, specifically for the private health sector. So let me give a background on this. When COVID started in Rwanda, the response was centered to the public, and yet the private was not yet being served. So after some time, the Ministry of Health in Rwanda realized that there was really a need to involve the private, and some private facilities were involved in responding. Some of them have been like having the taste of COVID-19 being done. Even some of them were even hospitalizing patients. So this kind of collaboration between the public and the private is actually a way forward. So, and then the private has to keep in mind that preparedness for emergency is something to be done and to be ready by these private facilities, because they play a crucial role in availing health services.
What future plans do you have for Health.Do, that is the e-learning platform which you founded? What future plans do you have for Health.Do in terms of dealing or assisting health professionals deal with emergencies in the future? What future plans do you have?
We are thinking of having a team, a multidisciplinary team of researchers, journalists, different scientists, maybe having in some advisors that will be preparing contents to be availed for healthcare professionals in Rwanda. We are planning to avail that kind of set on top, and then we start attracting. We increase the number of users on our platform in Rwanda, and but also scale to other countries within the African continent, so that we may avail information, real-time information for healthcare providers using digital technologies. This is the way forward for us.
That's all from us from Africa Science Focus today. If you want to find out more, head to the SciDevNet website. That's www.scidev.net. Today's show was produced by Alice Hurst with editing by Ogechi Ekeanyawo and Titilope Fadare. Reporting was done by Michael Kaloki. I'm Ogechi Ekeanyawo. Until next time, it's goodbye. Africa Science Focus is produced by SciDevNet and distributed in association with your local radio station. This podcast was supported by the Science Granting Council's initiative, which aims to strengthen the institutional capacities of 18 public science funding agencies in Sub-Saharan Africa.